Hey there, I'm Dr. Shannon Gregoire, and I want to welcome you to another episode of Vet Candy Rounds. Today, we're diving into the case of the one-eyed cat. Let's break it down. So, we've got a 7-year-old spayed female domestic short-hair cat coming into your clinic with some serious eye irritation. Conjunctiva's looking red, and the poor kitty's been scratching at it for a few days now. Now, what's your next move? Let's check out our options and think about our next steps. All right, so the treating vet performed a physical exam, eye check, and corneal stain. Results? Positive for corneal damage. There's a superficial ulcer going on. Now, what's the play here? Let's weigh our choices and figure out our next move. So, the treating vet prescribed some antibiotic ointment without steroids. But guess what? 3 weeks later, no change. Eyes still irritated, and the owners swear they've been on top of that medication. Now, what's the move when the treatment plan hits a roadblock? Let's brainstorm our options. This case, trickier than it seems. Despite starting off simple, this cat's not responding to treatment after 3 weeks. The vet even tried treating the eye with various antibiotics, but there was no improvement. Now let's bring in an expert, Dr. DJ Haeussler, a veterinary ophthalmologist, to help us with this strange situation.
Thank you, Vet Candy, for bringing me in on this stat chat. My name is Dr. DJ Haeussler with the Animal Eye Institute. So as we look at this case of a 7-year-old spayed female domestic short-haired cat, this cat had a chronic corneal ulceration of about 2 months duration. The cat had a corneal ulcer which was treated with a variety of antibiotics such as triple antibiotic, ofloxacin, genicin, and tobramycin, which was not healed. At that point, this patient was referred over to us. As I examined this patient, I found out that the cat did not have a palpebral response and had a complete facial nerve paralysis. When discussing the case further with the client, we find out that this cat also had prior inner ear surgery due to a polyp. So as we look at this case, how are we going to solve this? The cat has a complete facial nerve paralysis and a corneal ulcer which cannot heal of 2 months duration. So we decided to think a little bit outside the box. And I started to treat this cat like it had a corneal sequestrum, which is a dead piece of tissue in the cornea. We took the cat to surgery and we performed a corneal conjunctival transposition, removing the diseased piece of cornea in, sliding a healthy piece of cornea in, and then performing a partial temporary tarsorrhaphy in order to close that eyelid down to allow proper healing. So I'd like to show you the video that we performed, the corneal conjunctival transposition combined with the temporary tarsorrhaphy. I hope you enjoy.
So we're going to create our keratectomy here with the 64 beaver blade. And we're going to remove this diseased surface of the cornea, this diseased epithelium, down into fresh corneal stroma. So we're going to remove this section here. Now we're going to create our graft, our CCT, by dissecting this about 50% of the way through the cornea, freeing this up there. We're going to make our incision into our conjunctiva in order to allow us to then cut the limbus to free this entire graft up and have some movement out of the graft so that we can lay this into our ulcer bed there. So we're going to use A-dot Vicryl and attach 2 sutures at each corner for some cardinal sutures there, and that will allow this graft to hold in place while we go back and suture the entire graft onto the cornea. So again, A-dot suture, we're going to start here at the limbus, go through the conjunctiva and into the cornea. We're going to tie that down. This is going to be a simple continuous pattern all the way around this graft. This suture will stay in the cornea for about 6 to 8 weeks while it dissolves on its own. We're going to come all the way around this graft here Suture it down. Now that we've got this all sutured down, we're going to tie it down, remove our tags. Now we're going to perform a temporary tarsorrhaphy, closing off about 40 to 50% of this eyelid here to allow better healing.
So as you can see, a very intricate surgery that was performed, this corneoconjunctival transposition with very fine sutures, very delicate instruments, and very high-end microscope equipment. Thank you, Vet Candy, for bringing me in on this stat chat. I'm Dr. DJ Haeussler with the Animal Eye Institute. For more eye cases and eye tips, please join me on Instagram or Facebook at the Animal Eye Institute.
That's it for the show. Thanks for tuning in to Vet Candy Rounds. If you dug this episode, don't keep it to yourself. Share the love with your friends. See you next time.
When you talk to clients about parasites, recommend this parasiticide from Boehringer Ingelheim Animal Health. NexGard Plus is the one you want for one-and-done monthly protection. It prevents heartworm disease, kills fleas and ticks, and treats and controls roundworms and hookworms. Plus, the delicious beef-flavored soft chew is safe for puppies. Use with caution in dogs with a history of seizures or neurologic disorders. Give your clients one-and-done monthly protection with NexGard Plus.